Great, thanks. All right, so today's goals are to describe the meaning of MVC's episode-based claims data, discuss MVC reporting using our most recent SNF and home health report, and demo how these can be used with the registry to glean details about your medical patient population. So as a starting point, we'll just do a quick little overview of MVC data, just in case folks aren't familiar. So MVC has 6 different payers data sources. We comprise approximately 84% of Michigan's insured population. Those payers include Blue Cross Blue Shield of Michigan, PPO Commercial and Medicare Advantage, BCN, HMO Medicare Advantage and normal BCN, Medicare Fee-for-Service, and Michigan Medicaid. We have 30 and 90-day episodes for over 40 medical and surgical conditions, and these are formulated into what we call episodes of care, and these are broken down into different components such as index admissions, professional services, post-acute care, and any readmissions. MVC data is risk adjusted for patient differences. This is to take into account that some patients are sicker than others. Even if they may receive the same care, they may have a worse outcome. And price standardized to account for provider insurer differences. This takes into account things like location, time, contractual agreements with payers, etc. So because of this, payments and MVC data are effectively a measure of utilization. For our risk adjustment model, we take into account the following: patient age, patient sex, patient health history or comorbidities, and patient socioeconomic status. And then in terms of price standardization, we take into account things such as the payer, any contractual agreements, geography, or time. A little bit more about our data analytics. MVC members and partners can access their data in a number of ways, including our registry, push reports that we send annually or biannually, custom reports tailored to specific metrics, payers, or timeframes of interest to you, and sometimes as unblinded data that we show at our collaborative live meetings. We have several push report topics for 2023, which include pre-op testing, cardiac rehab, ED-based episodes, SNF and home health utilization, CHF and COPD follow-up care, sepsis, and many more. Next, I will go into our most recent report release, which is around skilled nursing facility or SNF and home health. A little bit about the report cohort. This report includes episodes of inpatient admissions between January 1st, 2021 and June 30th, 2022 for MVC's medical conditions. And these include AMI, atrial fibrillation, CHF, COPD, endocarditis, pneumonia, sepsis, small bowel obstruction, and stroke. And the payers included in this report are Medicare Fee-for-Service, Blue Cross Blue Shield of Michigan, PPO Commercial and Medicare Advantage, and Blue Care Network, HMO Commercial and Medicare Advantage. At this point, I will switch over to screen sharing the actual reports. So give me 1 second. Okay. This is the cover letter of our report. In addition to the cohort specifications from the PowerPoint presentation, I will also point out that episodes are excluded from this report if the patient had confirmed diagnosis of COVID-19. So this is under the patients included section here. In the first 3 diagnosis code positions on an inpatient facility claim at any point in the episode. Additionally, reports were only generated for hospitals with 20 or more episodes in 2021 and 11 or more in the first half of 2022. Additionally, this report includes some comparison groups. For this version of the report, those include your region, or your geographic region of Michigan, and the MVC average. And these can be seen on all of the Caterpillar plots throughout the report. I will also mention that there is a critical access version of the report, but today we will just cover the general acute care hospital version. Moving down to the first page with data in the report, we have some text here to help describe a little bit about the table here. This table is a SNF and home health profile table that covers 9 metrics separated by payer. The first 3 metrics in this table include all eligible episodes in the report cohort, and the metrics in gray have a denominator that's a little bit different, and that's of episodes where the patient utilized SNF at some point in the 30-day post-discharge window. So those first 3 metrics, and as a reminder, these are all patients, include 30-day SNF utilization rate in the post-index period, 30-day home health utilization rates in that post-index period, and SNF utilization rates in the 30 days prior to the episode's index admission. And each of these, as you can see, is separated by payer. Moving down, the next 6 metrics are of those who utilize SNF in that 30-day window. Those include average time to first post-index SNF stay in days, so how long between discharge to their first SNF stay, the average length of the SNF stay in days with a max of 90. And the reason this is 90 and not 30 is because somebody could start their SNF stay at, say, day 18 and then go past the 30-day window of the episode. Next is average distance from member zip code to SNF zip code in miles. So that is kind of an average distance from the center of both of the zip codes in miles. The mean age of SNF utilizers in years, average number of HCC or hierarchical condition category groupings of SNF utilizers with a max of 12. We have 79 different HCCs that are grouped into 12 categories. And then the percent of SNF utilizers living in an at-risk or distressed zip code. This metric is derived from the Economic Innovation Group, which in this paragraph here, there's a link if you would like to learn more information about that. If your hospital has a denominator of fewer of 11 cases in any of these columns, the metrics will display as less than 11. Moving into the next page, we cover some specific SNF metrics. So 30-day SNF utilization rates, so you can compare to other hospitals across the collaborative, as well as that MVC all and region comparison. 30-day SNF utilization rates by condition at your hospital, and conditions only appear in this figure for your hospital if you had at least 11 cases during the reporting timeframe. And then a table of the up to top 5 most frequently utilized SNFs after discharge from your hospital. So which facilities are those? And then at each facility, what percent of discharges to SNF from your hospital was comprised from that facility. The next page covers the same 3 figures, but for home health. So 30-day home health utilization rate, 30-day home health utilization rates by condition at your hospital, and then the most frequently utilized home health providers. Because this is the blinded report, these are blinded facilities, but your hospital should see the actual facility names in this table. And these were derived from CMS. And moving into the last page of the report, we show 4 more Caterpillar plots with slightly varying denominators. So 30-day SNF utilization rates among patients discharged to home. So this is, the denominator here is patients discharged to home, and then the numerator here is any patients that utilize SNF to achieve the rate. Next is 30-day readmission rates among patients discharged to SNF. So here the denominator is patients who were discharged to SNF, and then we calculate a 30-day readmission rate. Next is 30-day home health utilization rates among patients discharged to home. So like the first figure, the denominator is patients discharged to home, and the numerator is those who utilized home health in that 30-day window. And lastly, similar to figure 2, 30-day readmission rates among patients discharged to home health, with the denominator here being patients that were discharged to home health directly, and the numerator is those who were readmitted. At this point, I'll pause. This is the end of kind of the report walkthrough. See if anybody in the chat has any questions. Okay, if there's no questions, feel free to put them in the chat, and we'll go ahead and move on. Let me stop sharing for just a second, and then we will move over into the MVC registry. Okay. Next, we will go through a few reports you can find on the registry that relate to the SNF and home health report that we just walked through. Unlike our static reports, these registry pages allow for some more flexibility and granularity in the data you would like to see. Today, we are looking at MVC's training site, which has fake hospital names and data. So when you're looking at this, the hospital names won't be familiar to you, but you should see your hospital on there if you log into the registry on your end. Today, we're going to start by opening up the SNF report in the Blue Cross tab on the left side here. There are other tabs on the left that allow you to dive into specific payers. Today, we will be going through the Blue Cross version of this report, because the Medicare version of this report does not allow for as deep drill down. So after looking through the SNF and home health PDF report that you received, you may be wondering about, say, other SNF facilities or home health providers that you did not see in the top 5 tables included in the report. This SNF report on the registry can allow you to dive into some more additional facilities and allow you to filter to more specific patient populations. So first, I would like to draw your attention to the left side of the screen where the filter selections are. First, I'm going to select a particular hospital that has some high case counts. And let's set up some filters to get kind of a similar cohort to the report. So we will select under service line, medical, because the SNF and home health report focuses around our medical conditions. And then in order to achieve a time frame that's similar to the report, we will come down to the bottom. And normally you select 1 year at a time, but since the report is a 1.5 year time frame, we will select custom and then manually input the time frame we're interested in. So in this case, we'll select January 1st, 2021 for the start date, and then June 30th, 2022 for the end date. In order to confirm your filter selections, you can read the top of the screen here. It says initial post-discharge SNF payment, January 1st, 2021, June 30th, 2022. So we know we're looking at the time frame that we're interested in. Let's say we're also interested in looking at a particular condition. So I can come to the condition filter and select, say, sepsis. And the page will update with those filter selections. As the page loads, I'll just mention that there are plenty of other filters here to get to kind of a specific patient population, such as changing your payer, index place of service, patient gender, and so on. This is also a good time to point out that, as the title of the page suggests, this page only shows information about the first post-discharge SNF stay to that facility. So if you were interested in patients that had subsequent SNF stays, that data would not be included in this page. Okay, so we have our cohort set to how we want it to be. And this page goes into specific information about individual facilities, that SNF facilities that you discharge your patients to. And we cover the number of stays, the payment associated with the SNF stay in both unadjusted and risk-adjusted formats. So as a reminder, MVC data is all price standardized. So both of these columns are price standardized, but only the columns that say adjusted or ADA are risk-adjusted. And that is to take into account things like patient characteristics. This fifth column is a comparison group column. Right now it's set to MVC all. And if I wanted to change that to a different comparison group, I can come to the left side where the filters are and change it to, say, MVC region. And that will update the page. So now I can compare to MVC region 2. Lastly, a p-value was also provided to indicate the significance of the difference between the hospital risk-adjusted payments and the comparison group average. Each of these columns can be sorted. So if you wanted to look at the SNF with the highest number of stays or the highest payment, you can always use those column sorts to do that. Next, you may be wondering about some more home health specific metrics. I will mention that we do not have a page like this exactly for home health providers, but we can go into a couple different pages to get some more information about home health and other post-discharge payments. So if you navigate to the post-discharge payment drill down page, this brings you here. And here you're able to see rehab, SNF, home health, emergency department, and outpatient facility-based payments. If I hit the plus here on this rehab, SNF, home health payments bucket, it breaks those out into the individual categories within that bucket, which include inpatient rehab, outpatient rehab, SNF, and home health. So this page is designed to give your hospital a more comprehensive overview of post-discharge payments. And once again, these are both shown as non-risk adjusted and risk adjusted payments, along with that MVC comparison, whether you want to select MVC all or your region or your P for P cohorts. If you want to see a little bit more information about individual buckets and data points, you can select the blue column here on the bar chart, and it will bring up kind of the row at the top here, along with an observed to expected ratio, confidence intervals with the upper and lower bounds for the adjusted payments, and a little bit more detail about the total payment. Now, you also may be wondering about what your post-discharge rates are. And we have another page here titled Post-Discharge Rates Drill Down, where you can find that information. So similar structure on the page here, except prices are now shown as rates for each of these categories. You'll notice that both of these pages have kind of a repeating denominator across each of these categories. And this is to show that there is an N, or denominator, of 388 patients that fit this hospital with sepsis patients and all of the appropriate filters. But if I wanted to figure out what the numerator was, I can select, once again, the bar chart blue column here. And here you can now see the numerator that is being used to calculate that rate. So let's say I wanted to look at my home health rate instead of my kind of grouped rehab, SNF, and home health rate. Here it shows 21%. And at the top here, we can see the numerator of 82. And lastly, I would like to walk everyone through how to drill down into an individual patient. And to do that, you can select the numerator here, and it will bring you to our episode list. And I will point out that due to data use agreements, this functionality only exists for Blue Cross payers on the registry, or if you have qualified entity status, you can see your Medicare patients through the QE pages on the registry. If you are not a qualified entity and would like to learn more about how to attain that status, please reach out to us via email, and we'd be happy to assist you with that. So I will point out that sometimes this episode list takes a little while to load. So if that's the case, that's normal. You can refresh the page, and that usually fixes that problem. In this case, we have the episode list loaded here. And here you can see individual episodes. In this case, it's a blended facility name, but if you had access to more than one hospital on the registry, you would be able to see more. If you had, say, 3 hospitals, these would appear as appropriately in this column. What is the condition? In this case, we're looking at only sepsis from the previous page. Admit and discharge date, index length of stay, and then several different kinds of payments. And let's say we wanted to look at the episode in the list with the highest index length of stay. We can click on the index length of stay column, and we can sort by that. So clicking it once will sort from smallest to longest, and clicking again will reverse the sort. So we see this episode has a length of stay of 43 days. So let's go ahead and click on that episode and drill down a little further. This brings up more information about that specific episode. And again, sometimes these pages take a second to load. Okay. On this first tab, you can select the episode length. So if you're interested in looking at 30 or 90-day episodes in that post-discharge window, in this case, let's select 30. This brings up a lot of good patient information. So this is a male born in 1947 who came into the hospital with sepsis. They were billed for a DRG of septicemia or severe sepsis without ventilation, 96 hours. We show the primary diagnosis code, the admit and discharge dates, where the place of service was, and where they were discharged to. In this case, they were discharged to home health. We also see some payment information here. These are kind of high-level payments. But if we wanted to see a little bit more information about specific smaller buckets of payments, we can go to this next payments tab, which shows total episode payments, professional payments, facility payments. This episode in particular had a very long length of stay, so it incurred an index outlier payment. This episode in particular did not have a readmission, so we see $0 here. Their total discharge payment was, post-discharge payment was $2,688, and that was comprised completely of home health payments. and then any other professional payments, such as evaluation and management, other procedures, imaging, anesthesia, etc. Additionally, at the top, we have a tab for comorbidities, which allows you to see if this patient had any prior 180-day spending and if they had any particular comorbidities. So like I mentioned earlier, we have these 79 hierarchical condition categories or comorbidities, and these are all detailed here on this page. Next, if I wanted to drill down into an individual facility or professional claim, I could come to either of these tabs for that information. On the left side is the list of the individual claims. So I can click on any of these and it will update the information. So this includes the individual claim payments, the claim start and end date, the date and the time it was paid, the discharge disposition, and then any diagnosis or procedure codes associated with that claim. And then on the professional claim side, we see the same information. This patient in particular had quite a few professional claims, as you can see. And we can scroll down and see any of those professional claims associated with that episode. So lots of really good information you can get out of the episode drill down here. We often are asked by members about that patient level information. So this is where you can access that. I would also like to point out a couple more pages on the registry that could be useful to you. One of those in particular is the payment by condition page. And this can be accessed both on Blue Cross or Medicare. And this allows you to compare payments across different conditions at your hospital a little bit more easily on the same page. And then, as I mentioned earlier, if you are someone who has access to many hospitals on the registry, you can come to this page called Payment by Hospital, and you'd be able to see your hospitals and the payments associated with those according to the filters you select. So as you can see, there are lots of pages on the registry to explore. Today's kind of walkthrough is meant to show you how to take a report from MVC. In this case, it was around SNF and home health, find some information about that on the registry, and get into do some more slicing and dicing, that kind of stuff. We don't have time to explore all of these registry pages today, but if you would like someone from MVC to walk you through any of these registry reports with your hospital, we'd love to hear from you. So please reach out to us via email. That is it for my presentation today, and the remainder of the time today we have for anybody to ask questions, or if anybody would like to see the report again. So I'll open up the floor to everybody on the call.
Brad, we did get one question in the chat asking about the report. So from this report, how do we see what our denominators are?
Yeah, we don't show the denominator in the report, but if you are interested in seeing kind of more information about the cohort that was included in that report for your hospital, please reach out to us and we can do another deep dive for you in a custom report format.
Does anyone else have any questions for Brad? You can either put them in the chat or unmute and ask live as well. That's also an option. Also, I will plug that if there is anyone on the call who did not receive this report, last week, please feel free to reach out to us and we can send you the copy of the report for your site. Also to note, there is a PO version of this in development and it will be shared out towards the end of this month. And yes, we do have another question in the chat, Brad. So Brad, can you repeat what the gray area in the report represents? I'm assuming, Debbie, you're referring to the table.
Yeah, let me go ahead and share the report one more time. Yeah, so in the paragraph above this table, there is a description that these 6 metrics are comprised of those that utilize SNF in that 30-day post-discharge window. So the reasoning for that is because they're kind of SNF-specific metrics. So we wanted those to be specific to those that utilize SNF rather than the entire patient population. Who do we contact to receive the report? You can, if you did not receive it, you can, Chelsea just put it in the chat, Michigan Value Collaborative at med.umich.edu.
Any other questions for Brad? Anything specific about this push report or specific about how to tie this report to the registry, anything like that? Well, if not, Brad and I will stay on for the next 5 minutes or so, just to make sure that if anyone has any questions, that we can answer them. So you're welcome to stay on. And I am going to stop recording now though. And I hope that everyone has a wonderful day. And thank you very much for joining us for today's Lunch and Learn.